So let's break down this case study. You're dispatched to a local restaurant for choking. Upon your arrival, you find an elderly male. He's sitting at a table, coughing, dry heaving, and he's thumping his clenched fist against his chest. He's conscious, alert, oriented. He speaks clearly and states that he swallowed a bite of steak and he feels like that it went down the wrong hole. His skin's warm and dry. You do not observe nor auscultate any adventitious breath sounds. So you don't hear any crazy breath sounds, nor do you auscultate anything abnormal. So lungs are clear. He just continues to have a non-productive cough, and he states that his chest hurts and points towards his manubrium. So up here high, right below that sternal notch. So during this, your partner gives you a baseline set of vital signs. BP's 142/90, heart rate 74, 97% on room air, and you get a quick ECG of a sinus rhythm. So you're asked, what is most likely the cause of this patient's symptoms? To be having that chest pain and to feel like that they are choking, they're coughing, speaking clearly. So would it be A, obstructive bronchial tract, B, acute coronary syndrome, C, a partially occluded esophagus, or D, a tracheal obstruction? So let's think about these questions. Would it be an obstructed bronchial tract, meaning that it's went down through the trach and it's went into one of the bronchioles? Well, if that were the case, you would hear adventitious breath sounds and they would not be clear, so we can get rid of that. Acute coronary syndrome, possibly, but being up here high and everything that just went into it, not likely that. Is it a partially occluded esophagus, which is the food tract? Could be. Or is it a tracheal obstruction? Well, we can rule out tracheal obstruction because they're breathing in clearly, speaking in full sentences. So if you have a tracheal obstruction, that would be your foreign body airway, and they would not be able to breathe. So this is a partially occluded esophagus, and let me show you why. All right, so let's say here we have our esophagus and we have our trachea, right? So we got our food pipe and our windpipe. Well, if I get that big piece of steak, which I'm gonna demonstrate with a large nut here, and it goes down into the esophagus and gets kind of jammed, you can see that it's not completely occluding that hole. There's still a little bit of space around it, but now you can see the pressure that's put on the trach. So with that trach and it being pretty thick and rigid and the nerve pathways to it and the tendons connected to it, that's going to be causing that pain. But it's still able to move air. It's just compressed it. It's not being closed off. It's just having pressure exerted to it from that esophagus being overly stretched, pressing in on that trach. So this would be something that's commonly referred to as Steakhouse syndrome, to where a foreign body becomes obstructed in the esophagus and they cannot process it and swallow it. The peristalsis isn't working to be able to pull it down into the stomach. So most generally, the coughing is just that reflex that's triggered by the pressure on that trachea, stimulating that gagging reflex, that coughing mechanism, like that something went down the wrong hole. So treatments for this, it's going to generally be an endoscopy at the hospital. There is some research out talking about giving glucagon and its smooth muscle relaxant properties to be able to dissolve it, or anything that's going to cause smooth muscle relaxation. However, there's no empirical evidence or anything to really show that glucagon definitively works. There's other research that suggests like carbonated drinks just to kind of help the bubble and the fizz around it to be able to process it, dissolve it, to get it go down. But if it's not able to be completely swallowed or dissolved on its own, that's going to involve emergency endoscopy to go in and remove it.